you like to put your question?
Yeah. After being placed out of area for nearly 5 years, away from family and friends, it's lonely and detrimental to mental health when you rely strongly on help from others who still live in Brighton. I strongly agree with prioritising households who have been placed out of area in long-term temporary, who have a local connection for over 5 years, to Band A or higher priority bidding. How have you considered or prioritised households who are placed out of area with local connection who has needs to come back to the area?
Thank you, Amy. So, unfortunately, the lack of available temporary accommodation in the city, some households do have to be placed outside. We don't want to do this. This is a last resort for us. But unfortunately, there is a lack of available suitable housing. Geographical TA placement is not linked to priority need for housing. Where houses are placed in TA outside of Brighton Hove, there will be circumstances where they may be prioritised to be transferred to TA within the city when this becomes available. Now, this is an opportunity for you to take part in our consultation, Amy, and I hope you do. The Housing Allocation Policy Review consultation report on today's agenda recommends that the consultation commences on changes to be made to that allocation policy, and households already on the register and those who have homeless applications are going to be contacted directly and invited to respond to the proposals. And we sincerely welcome comments, especially people like yourself who can offer us the lived experience view. Would you like to ask a supplementary question?
Yes, please, and thank you for answering that. My supplementary question is, in terms of the household successfully winning properties on Homemove, I feel like there needs to be more transparency and consistent information given to service users on who's successful by bidding, priority date and band. For service users, it feels like housing officers or office staff could manipulate the results in the favour of certain households to win certain properties. They only show a selected few on the end of the property list at the minute. Having the winning band and priority date on show next to previous bids would give service users more clarity on their bidding positions. How can this effectively and consistently be done?
Thank you, Amy. That's a really important point, actually, and I think this should be part of our consultation. So I hope that you will add that to the consultation process. One of the aims of this new allocation policy is to do just that. I agree with you. There should be more transparency and there should be more consistency, and that information should be more available. So I certainly will be working towards that. Thank you so much for your questions, Amy. Very valuable.
Thank you.
Thank you.
Yeah.
Oh, hello, Nicola. Would you like to ask your question?
Yes. Thank you. Fairness of change and start date policy within the Homemove bidding system. For instance, a family of 6 has been part of the system since 2005. They were initially in Band D, later upgraded to Band C with a new start date of 2015. Resulted in them losing 10 years of bidding, creating an unfair disadvantage compared to others in that same band. Despite their 18-year involvement, the adjusted band start date reduces their effective bidding time to only 8 years. Could the committee review and rectify this policy for equal opportunity within the Homemove bidding system?
Thank you for your question, Nicola. And as you may have heard already, we are going to be looking at the Housing Allocations Policy Review and beginning a consultation on that if agreed today. So I really hope that you will take part in that consultation and provide us with your experience and your recommendations. Would you like to ask a supplementary question?
Yes, please. In respect to the bird flats at the top of White Hawk and the so-called 10-year survey, and residents cannot recall them being done before in such an invasive manner. Communication from the council had stated moving residents out of their homes was temporary, yet many have been rehoused permanently into homes, many of which have not been on home move. As a resident in the Bird Flats with concerning cracks in walls and ceilings, which many other residents have also reported, can the council please clarify and be transparent as to why this year's so-called 10-year check is so invasive?
Okay, thank you.
Thank you for your question. We're taking our third report in front of members today about new regulatory and legislative requirements. That includes the Building Safety Act. And the Building Safety Act requires us to do more invasive surveys on what we call large panel system blocks, and that includes the 5 blocks in North Whitehawk. So councillors have been advised from June onwards that we're doing these more invasive surveys, and that's to make sure that we can give or assure the building safety regulator of the structure and exterior of those flats as part of our duties under that legislation. I'm sorry if residents feel there's not been adequate communication. We have written to residents in some of the North Whitehall blocks seeking to arrange some moves so that we can get access to some empty homes to do those surveys. We require 3 empty homes per block, and in 4 of the 5 North Whitehall blocks, we haven't been able to get enough empty homes through our normal property turnover. So that was the basis of those letters. We did write to residents and ask for temporary moves, but I think we plan to come back to North Whitehall residents and both in writing and in person if necessary, and explain that a bit better. So I apologise if that hasn't been explained properly, but what we're trying to do is undertake these invasive surveys, 3 flats per block, to meet our Building Safety Act requirements. We have to go back to the regulator and tell them what the building safety case is for all our buildings, not just the large panel system blocks, but those blocks require particular surveys. And this is not just Brighton Hove, it's a national thing. So I hope that reassures you, and through the chair, we will make some more contact with the North Whitehall residents and write to you, and also probably arrange a community meeting just to explain where we are with that work and to offer any reassurance we can.
Thanks, Nicola. And I was actually at the Bird Blocks last Saturday morning at the Residents Association, and there were some issues raised around this problem that you just talked about. And we are planning to have a meeting there very shortly with Martin and some officers to help explain the situation and what's going on there. And I certainly will be there to help as well. So hopefully I'll see you there. Thank you very much for your question.
Thank you, yes.
Thank you. The next question is coming from Daniel Harris. Has Daniel Harris managed to get online?
I am, thank you.
Yes, welcome. Would you like to ask your question?
Welcome. Yeah, so I'm a previously looked after child from the old Brighton Council, and I'd really like to broadly praise a lot of the amendments here today, especially in this allocations policy stuff I've previously raised. So I have got a few other concerns though, particularly around care leavers. So I suggested some amendments to you in privacy around care leaver policy, which have been rebutted. We know that they're dying in Brighton Hove. 1 in 4 prisoners were or are care leavers, and 1 in 2 care leavers actually leave care with an undiagnosed mental condition. So can the chair please explain why this report is presented with no actual mention of care leavers, let alone a full draft of the policy to digest? And I missed the chair's communications at the beginning, by the way. Thank you.
Okay, thank you, Daniel. No, care leavers aren't left out at all. They are a priority, and if you look at the 2016 allocations policy, we're not about to rip it up and throw it away. We're looking to modernise it and make it fairer and more transparent. So please put this in the consultation as well, and please make sure that this is there, and I hope that you do. But care leavers are very, very important to us, and they are a priority already, and they will remain so. I hope that reassures you. Would you like to ask a supplementary?
Yeah, thank you. Yeah, and just would like to ask a question, because you've had 2 previous speakers that are part of service users of allocations, and they're part of the action groups. I'm just wondering why the papers fails to show that you're going to be consulting with them. You talk about all the third sector areas, you talk about them individually, but you're not actually talking about them as an organised group, which I think is quite disgraceful, considering previously when we've come to these meetings, you've promised that you would. So If you could just explain yourselves in relation to that, really, because you've agreed that lots of the things that the people are saying today are great. So why isn't this in the recommendation papers ready to go for consultation so that when everybody reads it, they can actually do it? And then if you look at your amazing equality impact assessment this time round, these great suggestions which people are coming forward from could have been put into that equalities impact assessment, and they could have all been consulted on with the people and the service users, the people that uses these that use this service. So it's just disgraceful and it's really unorganised.
Thank you for your comments, but I can assure you that all concerned parties and all stakeholders will be consulted. I'm afraid, I'm going to tell you that they are, okay, because that's my job. There is a list, I know there's a list, but it's not a complete list. And I remember with the landlords consultation, we actually looked at and included more people that came and suggested that they would like to be included as a stakeholder. If somebody wants to come to me and be included as a stakeholder, I will ensure that they will be part of that consultation, and you have my word on that.
So why is it not in writing?
Because the list isn't exhaustive, and there will be more people added to the list that wish to be added to that list. Okay, our next question is Magdalena.
Yes, good
hello.
afternoon.
Welcome. Would you like to ask your
Thank
question?
you for having me. Yes, please. So the question is as follows. Many families facing benefit caps and the third child rule in the private rental sector, they endure financial strain due to deductions from the 22k cap, impacting their ability to afford high rents. With local housing authority increases benefiting landlords but leaving capped households with less, the situation raises concerns. How many benefit capped households are currently on Homemove waiting list? And how can we highlight the urgency to address this disproportionate impact on vulnerable families, please?
Thank you for your question. I mean, I, for one, do think that benefit caps and the third child rule is disgraceful, and that can be on record. I'm quite happy for that to be on record. That are my private thoughts. But I don't have the power to overturn it, and neither does this council, unfortunately. That is up to the government, and I hope they do. I really do. So we don't have that information because that's not relevant to a home move application, I'm sorry to say. There are some exemptions to the benefit cap which can be applied for in certain circumstances, such as access to specific welfare benefits or working families tax credit, or by being employed for a certain number of hours, I do believe helps. But that's as far as we can help, I'm afraid, as a council. But I have much sympathy for anybody in that position, please be assured. Would you like to ask a supplementary question?
Yes, please, real quick. In relation to the allocation policy, legal advice has raised significant concerns. I am on Homemove. I've got 2 children with disabilities. One child receives high rate care, lower mobility. The second child receives middle care, lower mobility. And I've got a third child of opposite sex, age 8, with no disabilities. I've heard that the council stated there will be a medical officer reviewing medical related banding decisions. So who is that person? How can the person be contacted? When is that going to happen? When can that happen? And also, why all the properties I have seen on Homemove for people with disabilities are being just designated for people who are basically on a wheelchair or the such adaptations, where disabilities as a whole obviously covers other alignments, other medical conditions. Basically, we are being completely overlooked in this situation. I'm in the room now speaking to you from this room. We all live together in this room, and it's been for years in Band A. Could you please address my question? Thank you.
Thank you, and I am really, really sorry to hear this. It must be incredibly difficult for you. If you could contact us directly, and we'll look into your case specifically. Can you
thank you, I will. However,
I'll make sure that's looked at. All right, thank you so much for joining us today. Thank you very much. And please take part in our consultation as well, if you can. Thank you.
I would love to. Thank you.
Thank you.